This is Chapter 36, Patients with Special Challenges. So, the whole goal of treatment today is often to keep patients at home more than in some sort of facility, be it either acute or chronic care facilities. Some people that live at home, though, may require some pretty advanced devices in order to stay at home. Mechanical ventilation, IV pumps are some of the big ones. It's very easy to become distracted by the equipment and forget that there's a patient attached to that. The primary is still the same, focus on ABCs and then use the equipment that they have if it's working properly. And oftentimes, because they're at home, they will have somebody that regularly cares for them that is also trained on the equipment. So help them kind of deal with the equipment, get as much input from them as you can, because we are certainly not expected to be experts, especially at the EMT level. Some different disabilities that we may come across in the field, intellectual disabilities kind of are one of the categories. So a developmental disability is the insufficient development of the brain resulting in some level of dysfunction or impairment. This can include intellectual, hearing, vision that surface sometime during infanthood or childhood. Oftentimes, the intellectual disability makes it hard for the person to learn or socially adapt at a developmental rate that is considered normal. There are several different possible causes. It can be congenital, something that they've acquired while they were developing, can be illnesses that led to. It just kind of depends. There's a couple of different levels of impairment. Slight impairment, they may appear just kind of slow to understand, have a very limited vocabulary, may behave what we would consider to be immature compared to the other kids their age or the people their age. If they're severely disabled, they may not have the ability to live or function independently. They always have somebody that's going to be caring for them. And they may need somebody to help communicate or help them respond to their environment. Oftentimes, somebody with intellectual disabilities do rely on family members to give you the majority of their information because they won't be able to give you good, solid answers in some instances. Patients may have some difficulty adjusting to a change or break in their routine. It's really helpful for somebody that has a disability to be in their own environment and to have predictability. And so when we end up showing up, that's definitely not predictable and they have no idea what's going to happen. And so it just makes their anxiety much higher. So we want to make every effort to respect the patient's wishes, their concerns, because they are certainly as susceptible to disease as any other patient, sometimes depending on what has caused their disability, even more so. Autism spectrum disorder, this is a developmental disorder that is characterized by impairment of social interaction kind of as a whole. But there is a massive spectrum, so people can have a very wide range of disabilities. This can be severe behavioral problems, repetitive motor activity. So they, for example, they like to flip on the lights off and on a certain number of times. Impairment in verbal and nonverbal skills, often just mildly, they will have a problem with pronunciation. Often those on the autism spectrum end up going through at least some mild form of speech therapy, and they can be all the way up to completely nonverbal. They may be hyper or hyposensitive to sensory stimuli, sensory processing disorder, type characteristics are very common in kids that have autism. And so they may overreact at any sort of stimulation, or they may not feel or react to pain at all. Like I said, it's a massive, massive spectrum. So it's going to be kind of to each patient. There's really no one size fits all when we're talking about autism. Um, Patients often have the um, inability to understand normal verbal cues. It can be nonverbal means of communicating, sarcasm, they really struggle with. So it's best when you're talking that you try and be simplistic, very forthcoming, very honest in your directions. Frequently, they have difficulty maintaining or making eye contact. So that doesn't necessarily mean that they're not listening. It just means that they have a hard time with maintaining eye contact. They tend to have trouble answering open-ended questions. They may talk in robotic or monotone speech patterns. They may repeat phrases over and over and over. They might have a problem with pronouns when you say you when they really mean I, or they just, again, may be completely nonverbal. It affects males 5 times greater than females. That doesn't mean that girls are not susceptible to have autism. It just means it's more likely that it will be boys. They're typically diagnosed by around 3 years of age, and it's likely now that some older adults actually are on the spectrum and they were never diagnosed. Autism was something that is relatively new as a spectrum diagnosis, and a lot of people just didn't understand autism. We still certainly don't understand it well, but it wasn't something that was widely diagnosed even just 10, 15 years ago. We often are going to have to rely on somebody other than the patient to get information, but that again does not mean we're not going to talk to the patient. Talk to your patient and then bring in the family for additional information. Down syndrome is a chromosomal defect that occurs during fetal development. It can result in mild all the way up to severe intellectual impairment. There is a typical look to somebody that has Down syndrome. They have a round head with a flat occiput there in the back, enlarged, protruding tongue, slanted, wide-set eyes. They tend to have an extra fold on either side of their nose that covers all the way up to the inner portion of their eyes. Short, wide hands, small face and features, kind of a broad, flat forehead and nose. Patients that have Down syndrome are at a big increase for medical complications. As many as 40% have heart conditions and hearing and vision problems. And just overall, their physical health tends to be affected just like their intellectual health. Intubation might be difficult due to large tongues and small oral and nasal cavities. You don't necessarily need to worry about the intubation portion because you won't be doing that. That kind of comes in the world of ALS. And so sometimes we have to get awfully creative. What you're going to potentially have problems with is creating a really good mask to face seal when you're trying to ventilate. Trying to do a successful jaw thrust, it can be very difficult. So oftentimes you're going to have to put a nasopharyngeal airway in. Trying to put it an OPA might be difficult because of the large tongue, which I mean is something we definitely need to do to pull that out of the way, but can be difficult. Oftentimes those with Down syndrome are prone to seizures. We're not going to do anything different with a patient that has Down syndrome. Oftentimes they'll have medication at home that mom or dad may have tried to give them, and it just didn't work. Um, and approximately 15% of people with Down syndrome, the atlantoaxial joint, where the first two vertebrae meet, is very unstable, which makes them at an increased risk of complications of spinal cord injury when they end up experiencing trauma. So, more of a thing to keep in mind. For patient interaction, when you have somebody that has the potential to act erratically or immature, it can be intimidating. It's normal for you to feel um, uncomfortable, but if you treat them just like anybody else, calm, friendly, remain confident, they may have increased anxiety or fear, and so understanding how to work with them, definitely getting caregivers involved, saying, hey, you know, what can I do to help? Like, you can ask the patient a lot of times. Um, Often it's really better to have one person at a time kind of hold team members back until you establish a rapport. And then whoever gets that rapport, that's their buddy, man. And then you can start introducing your team members. But if you all bum rush at the same time, you tend to just really freak a patient out. Heck, we do that with people that don't have developmental delays. So just go slow. Um, when you're moving, go slow, but deliberately explaining beforehand what's going on. Um, and oftentimes we think that we need to take it down a notch, make it even easier to understand, but you'll be surprised, especially those with autism spectrum, while they can't communicate well or they have behavioral immaturity, a lot of them are super, super smart. And if you um, try to bring it down to a level that you think that they're at, they can get seriously offended. I've had several different patients that are on the spectrum, and you say, hey, you know, you're going to start an IV, and you take the uh, prep, the little thing that you clean the area with, and you say, hey, this is just cold soap. You know, and that's what I use for most people, because if you say it's an alcohol swab, they're like, okay, what the heck does that mean? So you say this is just cold soap to clean it up, and I have been corrected by somebody as to what that was and why I was doing it. So, I mean, definitely don't talk down to them or patronize them in any way. Brain injury patients, um, they may be pretty difficult to treat. They might be difficult to assess. Oftentimes, they still have memories or understanding of the life that they had before. They may have no idea that they have a brain injury. So it's definitely a good idea to talk with the family a little bit, get some background, try and figure out what's normal for the patient, because everybody with a brain injury acts different. It all depends on where it's at. They all progress in treatment different. So there's really no one size fits all for brain injury either. You want to still treat the patient with respect, use his or her name, explain procedures, and reassure them throughout the entire encounter so that they can still feel like they're taking part in their own care. We'll go ahead and stop here. I'll continue on in the next one.